Hello, welcome back to the channel and welcome back to the second episode in the Path to the Match series where I'm going to be discussing letters of recommendation. Letters of recommendation is a topic that I get a lot of questions on, and so I'm going to go through the most commonly asked questions that I get here and just some tips and tricks for uploading them, for securing good letters, who you should ask, when you should ask, things like that. So without further ado, let's jump in. So first and foremost, what is the point of a letter of recommendation? The whole purpose of a letter of recommendation is because programs are trying to hire you. They want to know what your work ethic and your personality is like in the clinical setting. They want to know about your clinical skills and they want to know about your clinical knowledge before you even get there because they want to know if you're going to be a good candidate for the job. And the best method they have at assessing this is by having someone who you've worked with closely in the past attest to this. They want a trusted, valuable source telling them that this person has good work ethic, good clinical knowledge, good clinical skills. And that trusted person is going to be your letter writer. In terms of how many letters should you should have at least 3 letters. The maximum you can send to programs in ERAS is 4. I recommend having all 4 if possible because this just gives programs a better sense of your clinical skills, your clinical knowledge, and you have just a few extra people to attest to your clinical skills, your clinical knowledge, and your personality. 2 of these 3 or 4 letters should be specialty specific. This is going to allow programs in the specialty that you're applying for to know that you are either passionate or that you have good clinical skills in that particular field or that you have good clinical knowledge of that particular area. That's going to be able to be conveyed to them by attendings who write you letters in that specific specialty. So who should the other 1 or 2 letters be from if it's not from someone in the field that I'm applying for? And the answer is it could be one of 2 things. Option A is you get your other letters from specialties where you have similar skills as those that you'll be using in the specialty that you're applying for. For example, if you're applying for OBGYN, one of your other letters may be from a surgeon because a lot of your surgical skills will be useful in OBGYN. Likewise, if you're applying for family medicine, you may want to get a letter from an internist because a lot of the skills that you'll use as an internist can also be carried into the family medicine practice. Option B is that you get a letter from someone who is in a field that is completely unrelated to yours, which is the approach that I took because I developed the best relationship with this attending, meaning that it would get me a good quality letter, which is something I'll talk about in a few minutes. But what I'm saying is that it doesn't matter who you get the other letters from. It can be from a field that is similar to yours. It can be from a field that is not similar to yours whatsoever, because this is going to show that you are willing to work hard in a specialty, even if it's unrelated to what you're interested in doing. A common question I get from international students is, can I have an attending in my home country write me a letter of recommendation? And the answer to that, for the most part, is yes. There are 2 types of programs, ones that are IMG friendly and ones that are not so IMG friendly. The IMG-friendly programs are usually going to be okay with you having a letter of recommendation from a physician in your home country, as long as it's a very good quality letter attesting to your work ethic and your clinical abilities. The not so IMG-friendly programs are probably not going to place a lot of value on a letter that is from a physician in your home country. However, this is not going to be the single factor that's going to hold you back from getting an interview there. The fact that you are an IMG applying to a not so IMG friendly program is the factor that's going to prevent you from getting the interview. They just don't accept many IMGs, and that's just how their program runs. If you can get a letter from someone in the United States, this is going to be immensely helpful and probably strongly enhance your application. It can be from someone you did research with, it can be from someone you volunteered with. As long as they saw your clinical skills or your work ethic or something, they're going to be able to attest to this, and it is okay to get a letter from them. The other question I often get is, can I have someone I did an observership with write me a letter? And the answer is you could, but it's not a great idea. And the reason I don't strongly encourage having letters from people you've done an observership with is because when you're doing an observership, you're usually not really allowed to see patients on your own, and you're also not really allowed to have computer access. So what exactly is the attending who's letting you do the observership going to write about if they can't see how you write a note or see how you examine patients or see how you take a history? How are they going to write a good quality letter? And the answer is they probably can't. The next thing I'm going to talk about is how to get a good quality letter of recommendation. And this can be very difficult because it's very easy to actually skip out on things when you're a 3rd year student, especially if your group is very large. I know that you have to study for shelf exams after being in the hospital all day. Trust me, I've been there. But you have to want to stay longer and go the extra mile if you want recognition and if you want a good quality letter of recommendation. Someone has to notice you're doing something if you want them to write you a letter. The first tip I have for this is use your residents as middlemen. Residents are usually very approachable, and if you let them know that you're interested in this specialty and you're trying to get a letter, they will do what they can to try and hook you up with the attending. And what I mean by that is they'll either let you go into their OR case, or they'll let you know when they're going to see a patient in the emergency room. They'll let you know when the attending is going to be available so you can get some one-on-one interaction with them. They'll also usually let you present patients on rounds. So if you take charge and you want some patients, you'll be able to present them on rounds, and your attending will be able to see your presentation skills, and they'll also get to critique your presentation skills. They'll get to pimp you, they'll get to test your clinical knowledge, and they'll actually get to see how all this progresses as the rotation goes on. The next tip is ask good questions and actively participate. I don't mean ask questions just for the sake of asking questions. I mean ask questions about your specific patient's care. For example, if you're on rounds and your patient is being treated with drug X, and you read a study a couple days ago, or you know from First Aid or UWorld or whatever, that you can actually use drug X or drug Y. Bring that up on rounds. Ask your attending if drug Y would be just as effective as an approach as drug X. This will demonstrate not only that you're reading at home, but it also demonstrates that you're interested in the patient and you're trying to figure out what is best for patient care. Another good time to do this is actually in the OR. There's usually a couple different approaches that surgeons can take to do surgeries. So figure out what technique they like the best and ask them why. Is there a decreased risk of complications? Is it a faster recovery time? Whatever it may be, try and investigate that. It'll show that you're a little interested and it will show that you're engaged. Another tip is take control of your patients. If your resident is doing you the favor of letting you have patients to help you learn and also to help you present on round so that you can get a good look from the attending, take advantage of this. You want to stay on top of their pending labs. You want to stay on top of their pending images and results and things like that. And this will be helpful to the resident as well, because they may not have seen that these images or these labs came back when they were doing 500 different things. But this will also show that you're engaged in the patient, and it will show that you are trying your best. Another thing you can do is make suggestions, whether it's with the resident or with the attending on rounds. Make suggestions. You're a medical student, you're not expected to know how to manage a patient. You haven't been through residency yet. Everybody knows that. But the fact of the matter is that you're trying, and you're trying to be engaged. And the last tip I have for getting a good quality letter is especially applicable for this year, so I'll touch on this towards the end of the video, but that is ask for the letter early on. Let the attending know you're interested in this specialty and that you're looking to get a letter. Ask them what their expectations are and things that you can do to help them write you a better quality letter. So the next thing is, who should I ask for my letter of recommendation? And the answer to that is who's going to give you the best quality letter. And the way that you determine that is who have you worked the most closely with? Who knows your clinical skills and abilities the best? Who knows you as a person the best? This is the person you want to write your letter of recommendation. It's going to give you the strongest letter, and it's going to look the best to the program directors who are reading it. In general, chairs of departments, program directors, and attendings with fancy names and titles who are in New England Journal of Medicine every other month are going to look very good to a program director who is reading your letter of recommendation. They'll probably recognize the name. However, if this is a general letter that doesn't really attest to your abilities, it's going to hold just as much weight as an average letter anyways. So go with the attending who is going to give you the best quality letter, who you know the best, who you have worked the most closely with. This is the most important thing in getting you a good quality letter. So in terms of how you should ask for the letter, I always recommend going in person, and I also recommend asking right at the end of your rotation. This is when you're going to be the freshest in your attending's brains, and this is when they're going to remember most of the encounters that they had with you. If you wait 3 or 4 months, they're going to have had 1 or 2 or maybe even 3 more cycles of students cycle through the rotation, and they're much more likely to forget you and their interactions with you. This also gives them a chance to write the letter if they want to do it right away while it is fresh in their head, and this is going to translate into being a better quality letter. In terms of uploading the letter, so basically how this works is when you get your token for ERAS, you're going to open your application. You're going to input all of the information, the name, the title, the email address of each of your letter writers. From here, you can generate an email on ERAS that sends your attendings who are writing you the letters a link to upload the letter to ERAS. You'll also have the option to waive the right to see the letter, and this is a box that you should check because if you waive the right to see the letter, it looks a little bit better than if you don't waive the right to see the letter. But if you do see the letter, don't click the box. It's not going to be overly harmful. It just looks a little bit better if you do click waive the right to see. I do recommend if you start any portion of the ERAS application early, this is the portion I recommend starting the earliest. This is a very long process. It will probably take a few reminder emails to get your letters uploaded, and it can just be a little bit on the frustrating side. The other thing is that it does take quite a while in terms of timeline. So for US students who are uploading their letters, they will be uploaded to ERAS within 48 hours of being submitted by the letter writers. For IMGs, your letter writer is going to upload your letter, and then ECFMG is going to approve the letter, and then ERAS will upload it. You don't have to do anything extra. This is done automatically when your letter writer uploads the letter, but the ECFMG approval can take anywhere up to 14 days, whereas ERAS takes up to 48 hours. So that would be 16 days total, would be the longest that you could possibly wait for your letter to be uploaded and show up on your dashboard after your attending who wrote the letter actually submits it. This could either be really quick or it could be really slow. It really depends when you submit it. 3 out of my 4 letters were submitted sometime in August for my September 15th application deadline date. And these were uploaded very quickly because it was well in advance. The system was not overloaded. I think the longest I waited for an ECFMG approval and release was about 3 days. And then the longest I waited for the ERAS portion of the upload was like 12 hours out of the 48 max. So it was relatively quick. However, my last letter, which I got from an audition rotation a couple days before my September 15th deadline date. So when this letter was uploaded, thankfully my attending was able to write the letter relatively quickly and upload the letter relatively quickly, but it did take 10 days for ECFMG to approve this because they were experiencing such high volume. And it took about 24 hours after those 10 days for it to show up on my ERAS dashboard. In terms of follow-up emails, there's a couple of different times you're probably going to have to send a follow-up email. The first time you should send an email is very soon after you ask your letter writer for the letter. And in this letter, you're just going to want to thank them for taking the time to write the letter for you and offer them a copy of your CV to assist them in writing your letter if they didn't already ask you for the CV, which they probably will ask you for anyways. The next time you'll be sending them an email is in late June, early July, whenever you get your ERAS token and you enter their information and you send the email from ERAS to them with the link that they can upload your letter at. And ERAS gives you the option, either you can send a generic email to your letter writer saying, hello, this is the link, thank you for writing me a letter, or you can personalize it, and that's what I chose to do. I just said, thank you for taking the time to write me a letter again. I will send you another copy of my updated CV to assist you in writing the letter. The deadline for the ERAS application is September 15th. In my case, obviously for you guys this year, it's going to be October something, but for my case, it was September 15th. Moral of the story is include the date in the email. Don't forget to say thank you and include your CV and send the link. The next time you're going to want to send an email is if it's approaching the deadline. For me, I used middle to end of August since my deadline date was September 15th. So I use middle to end of August as my threshold for when I was going to email my letter writers again if I didn't receive them or if they weren't uploaded. In this email, you want to thank them again. You know they're busy. Thank you for taking the time to write me a letter of recommendation. I know how busy it is. I really enjoyed my experience in this rotation. However, the deadline for this is approaching. Repeat the deadline date, whatever it may be. And if there's anything you need to assist you in writing the letter, or if there's any way I can help, please do let me know. Always offer your help if there's anything you can do. Remember that they truly are busy taking care of patients, and this is something they're doing in addition to their patient care duties to help you get a residency. So basically, in summary, when you want to send your emails, right after you ask them at the end of your rotation is going to be the first one. The second one is going to be from the ERAS application, sending them the link, which is going to serve as a reminder anyways, but you should personalize this email instead of sending the generic one. And the third one is going to be whatever threshold you decide prior to your deadline date is going to be the third email, serving as a reminder, hey, just don't forget to, upload my letter. The deadline is soon approaching. I were in the shoes of the 2021 applicants. These are just some things that I think I would be making sure that I would do. So they're just tips that I want to give you guys. And the most important thing that I can recommend is make sure that you schedule your auditions and your sub-Is early on. Program directors, attendings, letter writers, everyone is well aware that there's a pandemic happening. They're working in it. They know that this is happening, and they know that applicants still need to get residencies and that the application cycle is not being halted. If you're interested in applying for neurology, make sure your first rotation of fourth year is neurology. If you're applying for internal medicine and your internal medicine rotation was either cut short or completely cut out because of COVID-19, make sure that your sub-I or some type of internal medicine rotation, like an audition, is scheduled as your first rotation of fourth year because you're going to need that letter. For those of you who unfortunately did miss out on the rotation in the specialty that you plan to apply for, just remember that this isn't a special situation. It is in the sense that your rotation was essentially either cut out or cut short or whatever your school did. But keep in mind that every year there are people who apply to emergency medicine, which for SGU at least is not a core. There are people who apply to neurology, who for SGU at least, neurology is not a core. There are people who apply to PM&R every year. PM&R is not a core. There are people who apply to radiology every year. Radiology is not a core. All of the applicants in these fields have to make sure that their first rotation is a sub-I or an elective in their specific field because they need letters that they weren't able to get during their cores either. So just keep that in mind and hopefully it can give you some solace. Keep in mind that every single year applicants in these non-core rotation fields match and they are struggling at the beginning of the year and all stressed out because they don't have their letters of recommendation in that specific field because they didn't do it as a core. The other thing is, like I mentioned before, when you do start your sub-I or when you do start your elective in the specialty you plan to apply for and you know you want a letter, let your attendings know from day one that you're going to be applying for the specialty and that you are looking to get a letter and things were impacted because of coronavirus and you may have missed out on getting a letter from your core. Explain the situation. The majority of the time they're going to be understanding, but don't just stop there. Let them know that you will stay extra. Let them know you will go see patients with them in the emergency room when they're being consulted. Let them know that you are interested in going the extra mile. Also, ask them their expectations. What do they expect from a student if they want to write them a letter? Some attendings do have expectations for people who ask them for letters of recommendation. So know what these are at the beginning so that you can fulfill them. So in terms of letters of recommendation, that is all I have. I hope that you guys found this video helpful. And as always, if you guys have any questions, feel free to reach out. Don't forget to like, don't forget to subscribe, and don't forget to follow me on Instagram.